before entering the room, I'm gonna first gather my supplies. I have my clean gloves. I have my extra pair of sterile gloves. I have my bio patch. I have my dressing kit. I have the mask that I'm already wearing and the mask that I've supplied my patient. So now that I have my supplies, I'm gonna go ahead and enter the room. Knock, knock, knock. Upon entering the room, I'm gonna wash my hands for a full 20 seconds. Good afternoon, Mr. Jones. How are you doing today? Very good. My name is John Michael Lozada, and I will be your student nurse today. Can I have you state your name and date of birth for me? Thank you so much. Let me go ahead and scan your armband. Okay, that matches. Now, Mr. Jones, today we are going to be changing the dressing on your central line. Now, we do this every 7 days as to prevent any contamination or infection. And now, Mr. Jones, do you have any allergies that I should be aware of, particularly to chlorhexidine, tape, or latex? None? Are you experiencing any pain today? No pain? And do you have any questions or concerns about today's procedure? No questions? So you have a pretty good understanding of what we will be doing today? Very good. So, Mr. Jones, if at all during this procedure you feel any discomfort or pain, please don't hesitate to let me know. Now, I've already washed my hands, so I'm going to go ahead and don a pair of clean gloves so I can begin to prepare my workstation. So I'm going to grab a piece of sanding cloth and I'm going to wipe down the tabletop for a full 30 seconds, starting now. I'm also making sure not to only get the tabletop itself, but to get the edges. Okay, I'm going to go ahead and dispose of the sanding cloth. I'm going to allow the tabletop to dry for a full 2 minutes. Okay, 2 minutes has passed. I'm going to go ahead and grab my materials. I'm going to set them on top of the table. I'm going to doff my gloves. I'm going to perform hand hygiene, 20 seconds. And now I'm going to position the patient in a way that's not only comfortable for him, but will allow me to easily access the central line. And not only that, I'm going to ask Mr. Jones that you wear a mask and that you turn your head to the side. So is it okay if I assist you with that? Okay. Thank you so much, Mr. Jones. The reason we do this is to prevent any contamination during the actual dressing change itself. So now that I've done that, I'm going to perform hand hygiene, 20 seconds. And now I'm going to get my dressing kit and carefully open it, making sure to only touch the outer rim, like so. And I'm going to go ahead and grab my sterile gloves, set it aside. I'm going to drop in my bio patch. Dispose of that. And now I'm going to perform hand hygiene, 20 seconds. I'm going to don a pair of clean gloves once again. And what I'm going to do now, I'm going to assess the external length and measurement of the central line. So I'm comparing it to what was previously charted. It was last charted as 5 inches, so I'm confirming that now, that it is also 5 inches. And we do this to make sure that the sutures are in place and the catheter itself hasn't moved. So now that I've confirmed that, I'm going to go ahead and begin to remove the original dressing. Again, Mr. Jones, if you feel any pain throughout this removal, please let me know. I'm going to start by removing the tape first. And as I'm removing, I'm making sure to stabilize the central line itself. That way, again, the catheter doesn't move. Are you doing okay, Mr. Jones? It's not too bad, right? Very good. Okay. So now that I've done that, I'm going to dispose of the original dressing. And now what I'm going to do, I'm going to assess the site. What I'm looking for is any signs of infection. I'm looking for any inflammation, redness, swelling, or pus. So I don't see anything of that nature. The skin looks intact. And I'm also making sure to check the tubing. So I'm looking for any leakage or cracks, and also the tubing does appear to be intact. So now that I've checked that, I'm going to go ahead and doff my gloves. Perform hand hygiene, 20 seconds. And now I'm going to don my sterile gloves. Also making sure to only touch within a 1-inch border on all 4 corners, since that is considered unsterile. I'm making sure to fix my fingers now that I have them on. And I'm also making sure to fix the cuffs while only touching the outside of the glove. Okay, now that I've done that, I'm gonna go ahead and pinch the middle of the wrapper, like so. Dispose of it, making sure not to drop my hands below my waist. I'm gonna go ahead and grab the tubing with my non-dominant hand. And I'm gonna begin to clean the site itself. So I'm gonna go ahead and grab the chlorhexidine. I'm gonna crack it. And I'm going to wipe the site itself within a 2-inch border of all 4 corners for 30 seconds, starting now. Doing okay, Mr. Jones? All right, very good. This will be over soon. Okay, so now that I've done that, I'm gonna go ahead and wipe the tubing itself from bottom to top, right side, left side, back, and front. I'm gonna drop the chlorhexidine. I'm gonna allow it to dry for a full 30 seconds. Okay, 30 seconds has passed. I'm gonna go ahead and grab the biopatch, making sure to only touch the top of the biopatch. Apply it like so. Okay, so now that I've done that, I'm gonna go ahead and grab the Tegaderm, making sure to only touch the very tip of the wrapper. That way I don't touch the tegaderm itself. Okay, so now that the tegaderm is in place, I can remove the wrapper. Okay, so I'm going to secure the tubing. And I'm going to tape it in a way where the tubing is not touching the skin. So now that I've done that, I'm going to go ahead and label it. So I'm going to go ahead and write my initials, JML, the date, 9/16/2022, and the time, 1500. And I'm going to put the label right below the dressing. So now that I've done that, I'm going to go ahead and dispose of my materials, my old materials. And now I'm going to go ahead and doff my gloves. I'm going to perform hand hygiene, 20 seconds. And now I'm going to go ahead and assess the site. Again, there's no redness, no inflammation, no swelling. And I'm also ensuring that there is a cap and a clamp, and this is to prevent any contamination from coming in. And I wouldn't say this to the patient, but it also prevents air from going in, which would end up causing an air embolism. So now that I've confirmed all of that, I'm checking up on the patient once again. Mr. Jones, you can go ahead and turn your head now. I'll go ahead and assist you. How is that for you, Mr. Jones? Not too bad, right? Are you feeling any pain? No pain? We were able to tolerate that pretty well? Okay. And do you have any questions or concerns about today's procedure? No questions? Okay, so I'm going to go ahead and put the call bell right next to you. I'm going to put both side rails up, bed in its lowest position, and I've already performed hand hygiene. And once I leave the room, I'm going to go ahead and document the date and time, who did the procedure, which is myself, John Michael Lozada, and the assessment of the site. There was no redness, no swelling, no inflammation. And I'm also going to document the patient tolerance. Mr. Jones he didn't have any pain, and he was able to tolerate it pretty well. Thank you.